On TVC News. Let's talk health now, as the Nigeria Center for Disease Control and Prevention is advising citizens and residents to avoid all but essential travel to countries with confirmed cases of the Ebola virus disease. This follows a report of a confirmed outbreak of the Ebola virus caused by the Sudan species in Wakiso, Mukoro, and Mbale city in Uganda. In a public health advisory, the NCDC reveals there are no cases of the virus in Nigeria and that it will continue to monitor the regional and global situation. It adds that Uganda has experience in responding to the Ebola virus disease outbreaks as needed action has been initiated. Let's talk some more about this, bringing it in fresh insights. As we have with us the founder of Love for Health organization, Dr. Yusuf Harun. Thanks a lot for joining us again.
Thank you very much. It's a pleasure.
And we hear that Nigeria says it is the country is at a moderate risk following the discovery of this species, Ebola virus disease.
For it. So the vaccine is 99% effective. That means if people take this vaccine, they have a higher chances of not being infected. Just as we have tuberculosis vaccine, we have different vaccines.
So we're talking about a general Ebola vaccine, not just, yes, a vaccine that addresses a particular strain.
Now, the particular one is the Zaire strain. That is the one that has been approved by the FDA in the US.
And which has a near 100%
yes,
efficacy rate.
This one is a different strain. And the funny thing about Ebola virus, just like many viruses, is that they can mutate. Mutate means is that they can also adjust. As we humans are also trying to prevent them, they also have a natural way of also developing resistance or mutating, as it's called medically, changing into another strain to be resistant to the original vaccine which we are administering to prevent them or to reduce their outbreak.
Okay, would it be easy for scientists now, looking at the way it mutates, the speed at which it mutates, is there a way to beat it in its track by way of research? Where are we in that?
Now, my advice is even early prevention. What actually causes this Ebola virus? Fruit bats. So even we human beings should first start to prevent before we even get to the case of even the vaccination. Yes, we can, your question, but it would require more research and more funding, absolutely. But primary health care or public health gives advice. First thing is that we should even prevent this Ebola outbreak. And
you've even raised a controversial point. I use that controversial really carefully because bushmeat, there was an embargo at the time in 2014 against, the eating and all of that. We didn't exactly see a total eradication. People were still, eating and all of that. Now you're talking about, bat caution.
Yes, the fruit bat is the main carrier of this Ebola virus.
And that is in our own part of the world?
Yes, and Ebola also, it is called Ebola because of the Ebola River in the Democratic Republic of Congo.
Absolutely.
So that is exactly where it came. But in 2014, the outbreak came from Guinea. And it spread to many parts of West Africa, even outside West Africa, even outside Africa. There was a case in the US and some other parts. I remember then also in Saudi Arabia, there was a strict public health screening of people from Africa. It wasn't necessarily a racial thing, but it was because there was an outbreak of Ebola virus. So if you are coming from Africa, going to Saudi for Hajj, or you are going for business, and you're from West Africa in particular, you will be screened. So that is something which the government in Nigeria should also do. Anybody from Sudan, Uganda, or East Africa, you should take more time to screen them. If they have fever, you quarantine them, you keep them aside, you take their blood for tests. There's something called PCR, polymerase chain reaction. You also do different kinds of tests to make sure that they don't have any infection of Ebola virus. So this is something which we should take seriously.
Okay, and finally, so less than a minute though, you've spoken about the state or the need for primary healthcare centers to step up basically. So tell us where we are with that in terms of the existence and how much they do essential services or not.
Now, Nigeria and the health system in Nigeria is more reactionary than proactive. So it's until when there is a case or a confirmed case of Ebola virus in Nigeria, that is when all these borders, all these health authorities take it more or take it seriously. So for now, it still appears to be docile. It appears like there is no much strict awareness, but we thank TVC and thank people like you who are creating
our own, crucial points that you have just raised. That's why we also honor the likes of Dr. Stella Dadevo even today. But thank you very much for speaking with us.
Thank you very much.